Health leaders keep a close eye on the new COVID-19 variants that have been detected in the U.S., including here in Louisiana. Touro family medicine physician Dr. Meredith Maxwell joins us to discuss what we need to know. Good morning, Dr. Maxwell. Why do viruses mutate? What's happening here?
So it's genetic material. All viruses are prone to mutations, and they can mutate during mistakes or evolution to survive. And it creates variations that actually can propagate or drive the lifespan of the virus to be able to escape its enemies, so you say. So mutations can lead to changes in these proteins, and these changes can be advantageous, they can be harmful, or they can do nothing. So we see it all the time, especially like with the flu strain, the mutations that happen from year to year.
Which is why we sometimes talk about, oh, they kind of missed the flu this year, or okay, they've really got it under control with the shot.
Correct. So it's not surprising that this virus is doing this. And we're seeing 3 different strains or variants so far of this. And each one is seeing more easily spread. So the UK is more easily spread. That variant is easier to contract. The South African variant is associated with higher viral loads, so it's easier to spread, and it's also less vulnerable to if you've had the virus before for protection from your antibodies, which is alarming. The same with the Nigerian variant as well, so the antibodies are not working as well to protect you against this variant.
Moderna has talked about maybe getting a booster shot, for example. So far, this is not some worst case scenario. I mean, the vaccines are generally effective or thought to be pretty effective against these, right? Overall.
So far, it's not a guarantee that there's not going to be a mutation that is not further down the road. So I highly encourage everyone to get the vaccine now, to stop the spread, to stop the mutations, to stop that from possibly occurring. I think it's so important because you can't stop these mutations from happening, but you could stop the spread.
Okay, I want to emphasize that because I think that may be the most important thing from a what we can do aspect here. What you're saying is these things will mutate as time goes on. If you get the COVID vaccine, if you knock down coronavirus by not spreading it, then you won't in the future have some variant that might get us back to where we were a year ago.
Well, not guaranteed from year to year because there might be a need for a booster eventually. But for now, I highly encourage everyone to get it so that we can dampen the spread and make these mutations less likely to happen.
And on a more optimistic note, I guess you would say, we're almost out of time, unfortunately, but the trend here overall is viruses do become more contagious, but they also become less deadly over time. So that might be something to look for.
Well, and then we can tweak the vaccination based on these mutations later on. So I'm not saying that this is, the end all be all, we're not going to be able to beat this, but for now, while these mutations are happening, I think it's really important for everyone to get the vaccine.
Okay, Dr. Meredith Maxwell from Touro, we appreciate that very much.
You're welcome.